Good morning. Thank you so much for joining us. I'm Jim Skogsberg, President and CEO of Advocate Aurora Health. I'm pleased to be with you for our third virtual community town hall. We're grateful to have an outstanding team of pediatric physicians from Advocate Aurora Health with us today to help answer your questions related to our children, our grandchildren, our nieces, our nephews. Today, it's all about kids. With COVID-19 still top of mind, what do parents and those of us with concerns for children really need to know? First, let's introduce our distinguished panel. Dr. Frank Belmonte, a pediatrician and chief medical officer, Advocate Children's Hospital. Frank, do you mind just introducing yourself more to the crowd?
Sure. I am the chief medical officer at Advocate Children's, as Jim said. I trained here in Chicago at Chicago Osteopathic and did my residency at Advocate Children's and have been the chief medical officer for 3 years. I have 2 teenage daughters, a 15-year-old and a 13-year-old.
Thank you, Frank. And Dr. Kevin Dahlman, a pediatrician and medical director, Aurora Children's Health. Kevin?
Thank you. It's good to be here. So I went to medical school at University of Wisconsin Medical School, and I did my residency training at Children's Hospital of Wisconsin. I have 3 children who are 9, 8, and 5. I work as a local pediatrician in the Whitefish Bay area, as well as serving as medical director of Aurora Children's Health.
Thanks very much. And Dr. Marianne Collins, pediatric infectious disease. Marianne?
Thanks for the opportunity, Jim. So I trained at the University of Chicago, which at that time was Weiler Children's Hospital, where I did my residency and fellowship after going to med school at Indiana University. I've been with the Advocate system way before it was Advocate, since 1988, and I've currently the medical director of infection prevention and the director of the pediatric infectious disease section at Advocate Children's.
Thank you so much for being with us. And Dr. Kay Jacobs, pediatric critical care medicine.
Good morning, I'm Kay Jacobs. I am a PICU physician, so I work in the ICU. I'm originally from South Carolina, but I did my training at Southern Illinois University and the University of Florida, but I am a Gamecock, not a Gator.
Gamecock, not a Gator. We'll have to remember that. Dr. Gabrielle Roberts, licensed pediatric clinical psychologist.
Hi, I'm Dr. Roberts. I'm the pediatric psychologist at Advocate Children's in Oak Lawn. I'm originally from the Detroit area, studied at the University of Texas at Austin, and did my internship, which is like our residency in psychology, through Wayne State University and Hawthorne Center in the Detroit area. And I am a mommy to a lovely 6-year-old girl.
There you go. So we have an outstanding panel for you today. I want to thank you all for being with us. I want to mention that all of us came into this session wearing masks. So yes, everybody came in wearing masks, and we're going to put them back on immediately after we're finished with this program. And we want you to know how important masks are in helping us stop the spread of this virus, and we'll be talking about that during the course of this session. I bet that comes up more than once. This has been an unsettling time for parents, to say the least. We commend you for doing a terrific job. So many new issues have been dropped in your lap to deal with, and I know that it can be overwhelming. COVID-19 has prompted so many changes in our lives overall. We know those changes have been especially challenging for parents. There have been so many adjustments that families have been forced to make. Working from home is complicated, particularly with children at home, not to mention having the responsibility of guiding their education from home. Parents are struggling not only with trying to protect their kids, but also their older parents who are missing those grandchildren. And while all of us want to see children back in the classroom, most parents are asking, is it safe to do so? Will my children and my family be protected in the process? That's the reason we've decided to dedicate this town hall to answering those and more questions. These are the folks to do it. They are among the best in the field to provide insight. I have no doubt that there'll be great resources for all of you here today. So a few quick housekeeping notes for all of us. Please submit your questions and comments on the screen below, and we'll try to answer as many of them as we can in the time that we have available. Next, if we run into technical difficulties, and we hope we don't, we'll make this video available on our Advocate Aurora Health Facebook page for later viewing. We'll also have closed captioning when we push this out. Finally, please take the survey after the town hall to give us your feedback. It's very important to us. In fact, we dedicated this session to pediatrics because of your feedback. We plan to do more of these in the future, and your feedback is so very valuable. Okay, let's begin. With so much information circulating about COVID-19 and all the discussions about back to school and what that means, it can be hard to separate fact from fiction. So first question, Dr. Belmonte, I will give it to you, but all of our panelists, please feel free to respond. So we know that you are a father of 2 teenage daughters. So sending children back to school is sort of a personal challenge for you and your wife, I presume, as well as all of the parents that are tuning in. So here's the question that every parent wants answered. Is it safe to send my child back to school? Now that's whether it's elementary, high school, or college. Is it safe? What do you say, Dr. Belmonte?
So there's no real easy answer to this, but I think I'll tell you a little bit about my personal experience. I think we know a lot more about this virus than we did back in March. I think we've had some national societies, including the American Academy of Pediatrics and CDC, which have published guidelines. And my wife and I decided, based on our school plan, that it was in our children's best interest to send them back. But I think that that is a personal decision, and every family has to weigh the risks and benefits for their particular situation. So we're happy about our decision we've made, but we also want to support our neighbor's decision based on their particular situation. So,
how about the rest of the panelists? For those of you with young kids, 6-year-old, Kevin, your own situation, how are you looking at this?
Similar to what Frank said, you know, my husband and I are weighing all of the factors that play into this. So for us personally, it was important how our school was handling it, but I also just looked at individual characteristics of our family. So we had to look at it from a time standpoint, from an economic standpoint, all around. For us, the biggest thing it came down to, I think, was, not surprisingly, mental health and safety.
Sure.
And, you know, I'll tell you, I have friends who have children who were really happy at home. And my friends were able to sit with them and had the ability, and the kids were happy. And maybe if that was my kid, I might have more strongly considered keeping her. In this case, she's young, she's 6. The data is relatively encouraging at her age. And considering, although she's a trooper, and I'm so proud of how she handled everything, and if you met her, you wouldn't know she was upset by it, it really did affect her mental health. And so for that reason, things change every day, and so we'll see. But at this point, we're planning to send her, assuming that will be an option for us.
Gabrielle, I'm glad you mentioned that the data is somewhat encouraging, which is great to hear, because you sort of hear an awful lot of concern about the isolation for young kids, and so we'll definitely get into that in a second. But Dr. Dahlman, how about your situation?
Sure, and I would echo that too. I mean, I think it's important to take the whole picture into account. It's not just simply, you know, what measures the school has taken, but what about the social aspects and the mental health aspects of your children and what they get out of that socialization. I would emphasize here that one of the critical components of the CDC recommendations is to really follow a cohort. And it's really quite easy for a lot of schools to implement that in the younger age groups. It's really the high schoolers where it becomes a challenge because, of course, they have different academic schedules and they're going and mixing and mingling. Where the younger age groups are able to cohort and stay within that classroom. And that's really a protective mechanism to help prevent the spread throughout the entire school. So we're confident in our family that we're making the right decision for our children to go back to school. But I do have to tell you, of course, my patients are asking me this too. It's an individual decision. And there may be things that you may not necessarily know about your neighbor's child where there's medical illnesses to be thought about. You know, if you have an immunodeficiency, maybe it's not the best time to go back to school. So I'm just saying that we would really need to respect other people's choices in that, but put into place everything we can to make that decision safe.
That's a great segue, Dr. Dahlman, into this next question, which, Dr. Collins, I think about you, but I really encourage everyone to comment. So how are children affected by COVID-19? How are they affected? How would you answer that question?
So we know that children do get COVID-19, but they don't get it to the same degree or severity that adults do. We're seeing a lot fewer cases. Most of the data is saying that the incidence of pediatrics in the entire population with COVID is somewhere around 2%. Some data is saying 6%. Time will tell, but the incidence is low. The children who do get COVID tend to be mildly ill. A certain percentage are asymptomatic, and less than 10% are hospitalized, so that they don't get as ill as the adults do. That being said, There are very few kids that have developed this syndrome called MIS-C, which is the multi-inflammatory syndrome in children, which was first recognized in Europe and now is being seen in the States, and Advocate Children's has taken care of a few of those kids. It's extremely rare, but it exists, so that we know that we need to be aware of it, basically. I think it's also important to remember that kids are susceptible to a lot of illnesses, including the flu, which actually could be worse in the pediatric population based on the current data that we have. Time will tell, and I think we have to be mindful, as everybody knows, that data is changing, and we are constantly reorganizing our thought processes and our guidelines based on new data, and parents have to understand that and also be willing to take that into consideration when they're rethinking any of the decisions that they're making.
Yeah, that's a great point. This notion that, we're still learning, right? And this data keeps getting sort of gathered, and then we're drawing conclusions, and those conclusions do change a little bit.
Right.
I'm going to give you a freebie here because we talked before the session started. Do you want to make a comment about masks?
Thank you.
I think everybody wants to make a comment about masks, but I know you in particular, so please, for our audience.
And just for the audience, before we started the session and as we prep for the session, I wanted to I actually even asked, shouldn't we be wearing the mask during this session? But in the sense of the fact that we are socially distanced, meaning 6 feet apart, we know that we've been screened and nobody is ill. It was okay to take the masks off so that our audience would hear us better. But masks are critical. They have definitely been shown to decrease the spread and to protect people from COVID, so it's critical. Masks, wearing them all the time when you can't socially distance, and we should all stay home when we're sick, and we should continue to socially distance, wash our hands, and wear masks.
Yep, excellent. And I know we're going to talk a little bit about how do you keep masks on kids and so on and so forth here in a second, but you mentioned getting sick, right? Dr. Jacobs, you see the sickest of the sick in pediatric ICUs. Do you want to make a comment about sort of this COVID syndrome and how you've seen it affect kids? Because you don't really get them until they're pretty serious. So
yeah, that's correct.
I think the audience would appreciate hearing from you.
Absolutely. Like Dr. Collins was saying, most families don't have to worry about their child getting COVID syndrome or MIS-C. It's very rare, but I have personally taken care of patients with it in the ICU, and they are very, very sick. So we want parents to know that it exists and that they should be educated about it and the signs and symptoms they should look for and when to bring their child in to see us. The virus can cause like a hyperimmune response, and that causes inflammation in different organ systems in the body. This can affect the brain, the heart, the kidneys, even the lungs. So these patients can be very sick. Their symptoms can range from headache and neck pain to redness of their eyes to vomiting and diarrhea because it affects multiple different organ systems. We've seen this happen in patients who were COVID positive or antibody positive or had been in contact with someone who did have the virus as well. So if someone's child or family member is experiencing those symptoms, it's important for them to contact their physician immediately. And of course, if they have any life-threatening symptoms like difficulty breathing, if you're not able to awake or arouse your child or their energy is very low, if they've had persistently high fevers or they're not keeping food down, then they should come in and be seen urgently.
Such an important comment, and I'm going to offer my own personal observations on some of this. Like many of you, perhaps, I am amazed, disappointed, shocked when we do hear of individuals that sort of don't think this is very serious. Oh, this is just it's like the common cold and those kinds of things. It just amazes me. And then, thank heavens, we have an opportunity for you to talk about your experience in the ICU. This can be deadly serious,
Very
and
deadly.
we should treat it as such. So, thank you for that. If I can, Dr. Dahlman, back to you. Talk about well child visits and immunizations. We want to get those kids in, don't we?
We do,
And,
we do. It's really important. So as we're combating one pandemic, we certainly don't need to have outbreaks of another epidemic. So it's really critical for us to be able to see these patients come into our clinic. We're going to be working with your family to keep your child safe. We have the Safe Care Promise that has really taken to a new level safety in our clinics. So well child checks, if your child is due, we recommend that you bring your child in for that checkup. We want to update those immunizations because it's critically important to make sure that we're preventing any other diseases and illnesses moving forward. And of course, what we triumph as pediatricians is that preventive care model. So we could prevent lots of bad things from happening, and the way that we do that is by seeing your children. So give us that opportunity to take care of your child to help them live well.
I'm so glad you mentioned the Safe Care Promise because, you know, that I got to be careful with this because some of our colleagues have joked a little bit like, there's never been a safer time to come in, right? There's never been a safer time to come to the hospital, to come to the clinic, come to the office because of that Safe Care Promise and that wearing of masks and screening and social distancing and the virtual check-in and the enhanced cleaning, all part of that plan to give our patients confidence that you can come to Advocate Aurora Health and be well cared for. I'm glad you mentioned that. Thanks so much. Dr. Roberts, so given your unique specialty, and appreciate your opening comments, clearly some kids and parents, and I'm a grandparent, so and grandparents are kind of a little fearful about kids returning to school. We've talked about that. So what's your advice on how do you handle those feelings?
Sure. Some children will be apprehensive about returning to school. But as parents, we also need to try to differentiate between our fears and those of our children, especially if the plan is for them to return. We know our children pick up on our emotions, including fears about returning to school, and some of that is just unavoidable. But we want to try not to add additional anxiety onto our children about this. You know, I always think keeping them safe doesn't have to mean scaring them. But it's hard to sit down and reassure a child when you're tangled up in knots and feeling very fearful about this. So in that case, I recommend preparing for the conversation before sitting down to talk. Do your research. Learn the guidelines that are out there. Find out what your child's school in particular is doing to enforce those guidelines. Think about how that works for your family. Remember that you can have an influence on your child's safety even when you're not with them by teaching them good hand hygiene, practicing wearing masks for long periods of time, and talking about the rules that are in place, the new rules that are in place in school, and making sure your child understands how to follow those rules. So even if as a parent you're not fully convinced, taking action, so doing things, and also focusing on those things in the environment that are in place to keep your child safe can help you and your child better manage stress around this. So in other words, control what you can control. As in any other year, along those lines, as in any other year, you know, leading up to the school year, it helps children transition from summer to school. If we adjust bedtimes and wake times about a week or two before the start of school, this year especially, we need our kids to be well rested and mentally prepared to adjust to these new circumstances and tackle any challenges that may come their way. And as parents, we need to keep an eye on ourselves and our own mental health and our own stress and manage that stress. Call other adults, talk to them, vent about your fears. I do this on a very regular basis. Crying is sometimes involved, and that's okay. But also be mindful of what you say in front of your children, and exercise kindness to yourself when you do slip up, because you probably will, because this is just hard.
Yeah.
I'll jump on that, Jim.
Great advice, yeah.
So I'll add that my son is actually having surgery this Friday, and we had him COVID tested, of course, in preparation for that surgery, having no idea that he was anxious about the result. And we told him yesterday, came back negative, and he was ecstatic, like a big, huge weight had been lifted from his shoulders.
Because he hadn't shared that anxiety with you, right?
Exactly.
Yeah.
So I'd like to encourage all parents here, talk to your children about it. You know, we don't want to overdo it and put something in there that is not in their minds, but at the same time, you need to call it out, because sometimes kids are not going to exhibit anxiety the ways that you and I do.
Agreed. You need to ask and listen.
Yes, right.
Yeah, no, that's terrific. Thank you for sharing that. So I mentioned a second ago that I'm a grandfather. So this question is, I could have written it myself and wrote in. So the question is, once school starts, but whether school starts or doesn't start, should kids stay away from their grandparents? Please tell me the answer is no. But honestly, this is a question that comes from our audience because you want to protect your kids, and yet we also know that grandparents are support systems as well. Yeah. So how would you as pediatricians respond to that question? What about exposure to grandparents?
I think it depends on the situation. As we mentioned at the last session, if you have a chronic medical condition or have some other issues, we probably would not want to, bring a lot of people into that situation. If you're a healthy person and you can still do the social distancing, meeting outside, not a lot of hugging or anything, we probably can do it in a safe manner. But I think it's each individual's personal decision based on their risk factors.
Any additional comments?
I think, like everything in the medical world, we weigh risks and benefits. So, if there are great benefits to grandparents being able to spend time and love on their grandchildren, but there are some times when the risks outweigh that if there's some medical issue going on.
And I think we're lucky at this point that we do have all the technology that we have, so that if we can't do what Frank just mentioned, that we can at least try to use the technology in a way that is fun. Not just, and it's hard for little ones, but try to be creative. If you're Zooming with little ones, using puppets, using stuffed animals, playing games, there's all kinds of stuff on the internet in terms of how to interact with kids, because they do lose interest, especially since they're spending more time on the screens than before. Or maybe they're shorter visits, but let's at least leverage that in the situations where we can't be together in person.
Sure. Dr. Roberts, I'm thinking about your environment, which is pretty unique. How are you handling parents and grandparents who want to visit their loved one in the ICU today? How are we handling that today?
It's tough. It's really hard for families because when your kid's in the ICU, they're very, very sick. So lots of family members want to come, whether or not it's parents, grandparents, aunts and uncles, everyone wants to check in. But unfortunately, during this time, we have to do the safest thing possible, not just for the patient, but for their families as well, too. So right now, we're really just allowing one parent at the bedside, and I know that's very difficult. And whenever I tell families that, my heart just breaks, I'm not doing that because, or we aren't doing that because we want to be mean. We love having families involved. That's what we do. But just right now in this uncertain time, that is the safest thing for everyone. But we do a lot of the other options where we encourage FaceTiming and things like that. We have very great specialists that have the capabilities of offering those Zoom meetings with family members for those that don't have cell phones or iPads here to be able to use. So we do try to do that. We encourage family members to write letters to the patients. We come in and read their letters with them, and all of those things to keep them connected with their families while keeping everyone safe.
Yeah. Is it your impression that most of the parents or the family members understand the greater good? I know you're dealing with frustration. I mean, I know that is a message that family members wouldn't necessarily want to hear, but do they ultimately kind of understand we're really looking out for the child's best interest?
They do, and that's really one of the reasons why I went into pediatrics. Like, everyone wants their child to get better. No one wants to see a child that is sick. Kids don't deserve a lot of the things that are brought on to them. They're all very innocent. So families really want, their patient, their loved one, their child or their loved one to get better.
Yeah.
I would say, Jim, one of the most remarkable things through all this is families have been, we really have not had problems. No. They want to keep it safe. They want to make sure it's safe for our staff, and they've just been great partners.
So let's stay on that safety theme. Here's another question that came up. So what safety measures should families take once the kids return home from school each day? Should we be, I'm going to continue, should we be obsessively cleaning surfaces and toys during this pandemic? So kind of wrap both of those in. What steps would you suggest mom and dad take once their child comes home from school? Immediate shower, or what are we talking about here?
Hose in the yard.
Yeah, hose in the yard. There you go. Yeah.
Well, but maybe start with washing hands and face.
Exactly.
That might be a good start.
Yeah. Hand washing should always be number one, no matter who, what, when, or where. Hand washing would be important. Simple things like taking your shoes off before you come into the house or right at the entryway, and that's a good thing for everybody to follow. I have seen some guidance for healthcare workers about changing their clothes. It's not been real specific for kids. I have seen a few areas that have talked about kids should change their clothes. That's not real specific at this point, but it's something to be considered. I've seen also some guidance about just wiping down backpacks, etc. But I think going back to hand washing is really the most important, basically.
Yeah, back to the basics, right?
Right.
And hand washing. Right. Which, by the way, a little plug for during this session, we are using our hand sanitizer along with the masks, so we're trying to walk the talk as well. Next question. What are the best ways to still encourage socialization with kids? So, we don't want them, the social distancing, 6 feet and so on and so forth, but what are we encouraging about socialization with kids? How would we do that? How would we suggest it be done? What do we need to be careful about with socialization? Thoughts about that?
Sure, I can start,
Yeah,
and
please.
then my colleagues can. First of all, I really appreciate the question, which is sort of why I jumped on it, because it's really important. I think it's something we've all been struggling with as parents, and we know our children need it, and they crave it. I've had multiple friends tell me anecdotes about walking with their child down the sidewalk, and their child sees another child, a complete stranger, and they sort of look at each other longingly, like they want to run together and start playing. They don't even know each other.
Right.
So we know our children need socialization. We know it's going to look different right now. I think for children who do return to school, although it will look different, they will have more opportunities for socialization, which is a good thing. But until then and outside of that, like you said, outside play is a really good option. Parents can arrange bike rides, picnics, any sort of outdoor activities that you can do at a distance. Also, some families have felt comfortable creating bubbles where they have a family or two where they're comfortable with how that family is taking precautions, and they'll enable those children to play or allow those children to play in a little bit more of a natural way. That's something. I have an only child, and she was very isolated, and so that's something that we made a decision to do in our neighborhood, and it has been a game changer. And the other thing, teenagers will meet up in cars, take walks, sit in parks, depending on how comfortable the family is with a bubble versus if you can trust your teen to follow through with social distancing and things like that. And as Marianne mentioned, Dr. Collins mentioned, social media. I will fully admit that I am outside of COVID, I am very close to the very limited screen time end of the spectrum. And yet it has been a lifeline for so many children and families, as you mentioned. And especially those apps that enable our children to see each other and communicate in real time. That's huge, and it's something that's really been helpful and a really good option right now too.
I'm thinking that you are cheating in looking at these questions. The very next question, and we want to kind of keep both of these going. The very next question is it okay for children to be on the internet more today now that there's really nothing else for them to do? And it's interesting that you went there right away. That internet is.
I don't think there's any rules right now. I think that each family has to decide what's going to work for them and their balance. If you could balance that with a little bit of outdoor time, and there's ways of doing it. And getting back to what Bree said, so dealing with teenagers, they're social beasts. They need their friends. So they did as much as they could, my two, on social media, and then we've allowed them now, taking advantage of being outdoors, having friends over on the deck, so we can kind of supervise, but. They really do need that social connection to their friends. It's so important for their mental well-being.
Other comments?
Well, I'd say for elementary school kids, my 8 and 9-year-olds has really benefited from doing FaceTime to one of their classmates and friends to keep those connections tight. And in fact, we've gotten real creative. For a couple times, we've did a drive-by play date. So we take the kids in the car, we stay in the car, but at least just to be able to see the others from their property has been really a fun experience for my kids. Obviously, as a parent, you want to be very well aware of who your children are talking to online, that they're not meeting strangers or doing anything like that. But safely, it really could be a very nice social outlet to encourage that social development for children.
I think the other thing that I've read a lot and seen a lot, and it was brought to mind to me the other day when I was making rounds and saw pictures on the entryway to the hospital that kids had made for the healthcare workers. So I think engaging kids in activities for somebody else will also help them feel connected and feel like they're doing something. And there's different types of things that can be done by different age groups. We just have to be creative about it.
I agree. Can I add something too
Please.
about the internet? Just sort of thinking about everything that's been said, and I think some good ways to think about it are, first of all, I try to think of the framework, and it's sort of echoing what everyone said. I try to think right now, as Frank said, I think there are no rules or few rules. I think there should be rules at home. The rules are going to look different than they did before COVID. But I think having boundaries and having some rules and still having some consistency at home is good. And I try to use the framework of thinking how they're using the internet versus if they're using the internet. So if they're spending more time on screens, but they're using a portion of that you can use extra screen time as a reward for things done around the house, which is a win-win because something gets done around the house. And you know for at least, 15 minutes of the day your child wasn't on a screen and they were doing something else. And as Frank mentioned, just having that balance is just really important. Making sure they are also getting exercise, they are also getting fresh air, even if it's more screens. And even having a list of these other things they can do when they're not on the screen can be helpful so that when you ask them to turn it off, they don't look at you, deadpan. and just be aware that there will probably be a time when we have to scale this back, and it will probably hurt. But so go in with your eyes open and just know that hopefully the pain of having to pull the screens back a little bit will be offset by the excitement of rejoining life as we previously knew it.
Yeah. So let me ask you, let me flip that around a bit. How are you, as practicing physicians, how are you getting your free time, your downtime, your exercise, your fresh air? Are we practicing what we preach? How are you connected to the world outside of this small, focus on COVID now as pediatricians? Talk to the audience, because they're all adults and thinking about this. Am I doing those things that I should, to take care of myself so that I can take care of my family? Talk a little bit about your own experience.
I am personally spending a lot more time outside. I would say going on a lot more walks. Just kind of fresh air is just so important. Spending more time on my balcony, just getting some natural sunlight in. I'm also FaceTiming a lot more. So most of my family is in South Carolina. So before I would be more prone to just making a phone call. Now I'm more likely to just go ahead and FaceTime and get to see. You get to see your parents and my brothers and my niece and all of those people that I miss back home. So definitely more time outside, more time doing that. And I think you have to. Working in this environment can be very stressful for us. We see this and we live it every day, and it can be very scary. So even if your body shows you when it's time to take care of yourself. I remember when COVID first started, and I had some really tough cases in the ICU, and I don't think I was doing a great job with taking care of myself. And I woke up at like 3 o'clock in the morning. My heart was racing. I could not stop thinking. And it was at that time that I really knew that, you really have to practice.
That was your wake-up call?
That was my wake-up call.
Yeah.
And I went on a walk at 4 o'clock in the morning because I just needed to go outside, and I just really woke up the next morning and realized that you have to take care of yourself and do all the things that you tell other people to do.
I think about your specialty in particular, Dr. Jacobs. It's a relatively small sorority or fraternity. Who do you stay in touch with? Do you have colleagues around the country? Because there's some other hot spots, right? We're pretty fortunate right now, both in Illinois and in Wisconsin, that our numbers are somewhat stable. They've kind of creeped up a little bit in Wisconsin, I know, but for the most part, they've been relatively stable. And yet we're looking around the country and these numbers are skyrocketing. Yeah. You must have colleagues in some of these hot spots that are slammed.
Oh, absolutely.
Do you have conversations with them?
All the time, especially when I get stuck on patients. They are definitely my key colleagues that I call at any time and say, hey, I need you to help me out because I don't know what else to offer, what else to do here. And I trained in Florida, so I have a lot of friends that are back there. So definitely a lot of people who are seeing this a lot more in areas that have a greater caseload than what we have. Mm-hmm. But we are definitely constantly in contact with each other because this is new and we're learning a lot and things are growing and developing, and it's important to have multiple minds coming together when you're trying to deal with this.
So you're taking walks at 4 a.m. We got that.
That's correct. That is correct.
How about the rest of you? What are you doing to take care of yourself so that you can be all the pediatrician that you want to be?
So I know for my admin days, I haven't had the commute time. So that's really afforded me the opportunity to get outside during that time. But I would say the caution is when you're working from home on the admin days, taking a lot of Zoom meetings, that kitchen is really close. So you have to watch it because the snacks are right there. So it's been a challenge, but it's also been a blessing. So trying to walk that fine line.
Yeah.
We recently took a week off with the family and rented a house in Michigan. And I hadn't had a week off since December. So I didn't realize how much I needed it. And what we're really encouraging all of our physicians and staff is even if you're not going anywhere, take some time off this summer because we don't know what the fall is going to bring. And we want people to get a little bit of R&R, so that they can work to their peak, like Kay said.
Yep.
I did the same, and it was really key. And in addition to some of the things others have said about spending more time outside, I have a scheduled happy hour walk with a friend who's in my bubble on Thursdays. It's very nice. And limiting my intake of news. So I'm seeking it in certain ways at certain times, but being careful about that. Some reframes for myself. being at home can be frustrating at times with work, but I've always complained that I don't have a window in my office. And I have a window in my office now. So I'm trying to think about it that way.
There you go.
You know, just trying to look on the bright side. And I do some online fitness classes as well.
Yeah, yeah. Anything, Marianne?
Mostly walking every day, trying to get outside and seeing the sunshine. There are days when you look and it's like, oh my gosh, it's 7:38, I need to get out there, but I think that's been critical. And then planning ahead, trying to figure out what we're going to be doing in the winter when we can't do those walks, although I think we're going to have to do more in the cold weather than we used to do.
Right,
basically.
yeah, exactly right. Good advice for parents and grandparents who care deeply about their family members, so thank you for sharing that. There was a question earlier about KN95 masks. Fitted properly for kids, should we be concerned about that? What is the proper fitting of for a mask for young ones? Comments about that?
Yeah, masks basically should be comfortable, but they should provide a seal over the nose and the sides of the face, and then be comfortable enough that they're not tight around the ears so that the child will be willing to wear them. So I think that for the kids, especially the ones who are going to be going back to school, it's worth starting to practice wearing a mask so that they don't go, just like Bree said, starting to get them ready for this so that it's not a shock situation the first day of school. And the same thing, washing their hands, how to take their masks off, and just make it part of everyday life, because it's going to be part of everyday life now for a long time to come.
Yeah.
And so it's wash your hands, wear your mask, and social distance.
There you
Wash
go.
your hands, wear your mask, and social distance.
And we've been saying that since the outbreak, haven't we?
Right.
Yeah, thank you for that. Any other comments about that one? We have a whole bunch of questions. So
I would just
yeah.
comment that really children don't need an N95
Right.
mask.
Thank you, Frank.
Even in the hospital, we're only using them for certain procedures. So a regular mask, a cloth mask, or a procedure mask is all they need.
Right.
Right.
And I think it's probably worth reinforcing that you wear the mask to, in a sense, protect someone else from you. And that's why you want someone else to wear the mask to protect you from them, right? So want to wear that mask. Here's another question. We've sort of talked about it, but give you a chance to maybe provide some additional insight. I'm nervous to take my young child to a doctor's office. How should I prepare? How should I prepare? So, you know, we're kind of back to, we don't want you to be nervous, it's safe, but how do I prepare for that? And I know you'd say, talk to your child about, you know, you're going to go to the office and you're going to see masks and so on, but what other advice would you give a parent that's getting ready to bring their child in?
I mean, I've talked to a lot of the pediatricians in our network. Every single one of them has safety procedures in their office. So if you're concerned about what to expect, I would say call ahead, talk to the office manager or the nurse and find out what to expect. Here at Advocate Aurora, we are following the Safe Care Promise. We have paced the cadence of our visits, so you're not in a waiting area. We're bringing you right back to the room. We have plexiglass installed. All of our associates are wearing masks. So again, getting back to what you said, this is sometimes the safest place for me. When I come into the hospital or a clinic, I know that everybody's going to be following the rules.
No, just to go with what Frank said, along with calling and asking, I think parents shouldn't be afraid to directly express their concerns. Get a direct answer to that. Say, I hear you saying this, but this is what I'm concerned about. How are you going to address that for me?
Right.
And understand and get educated on how maybe that will make you feel better instead of sort of harboring these questions or
Right.
holding them and then just getting
Yeah,
what
be
information.
assertive about your child's
Yeah,
health and,
yeah,
and,
you're the
and
parent.
wellness. Yeah, absolutely. Great. Next question. It has been said that kids do not spread the virus or react to the virus like adults. How accurate is this, since kids have been quarantined for several months and not out in the public? Is there anything special about the quarantine period for kids that would be different than adults? Do they actually spread it just like everybody else? Because we understand the virus gets spread by anybody that has it, right?
I'll start with that, and there's a lot of answers to that, and the data is continuing to come and to change the answer on at least week-to-week basis. We know that children don't get as sick as adults do. Part of that might be because of receptors in their lungs. That's a theory yet to be completely proven. We know that kids are, at least the younger children under age 10, tend not to spread the way as efficiently as adults do. That may be because their cough is not as forceful as an adult's. And some recent literature has shown that as they've looked at epidemiologic studies with respect to household contacts, children under 10 and children above 10. We also know that a certain percentage of kids and adults are asymptomatic, meaning that they have the virus, they don't show symptoms, and they are probably still spreading the virus, maybe not as efficiently as people who actually have symptoms. So these are all the guiding thoughts currently, and more literature is coming out and will be coming with respect to actually further numbers as kids go back to school. It's being watched extremely closely around the world and the United States by all the experts.
Other comments about that? We're good? Okay, thank you. Now, pediatric flu. The question is, did the pediatric flu cases drop this year due to the kids being quarantined? How do we prepare for the flu season coming up? Has there been a diminished flu this year because of quarantine? Let's start with that question.
I mean, I would say that we saw a diminish of all respiratory illness once kids left school. So after that March date when people went home, because of the bubble and because of the quarantine, they weren't passing respiratory illness to one another. We don't know what it's going to look like in the fall because we haven't really had them back in school since March.
Other comments about
We
that?
would presume that, of course, as the kids go back to school with reopening in person, that we would see an increase in that. The question is again, social distancing and masking, hand washing is going to have to influence that for the good. So we're hoping that that's going to help. But there's still a lot that we don't know yet.
I would just add we actually do have a vaccine for the flu. So it is recommended that you get your vaccine for the flu and your children get their vaccine for the flu because we can prevent that.
That bears repeating. I mean, does it not? I mean, this notion of get your child vaccinated for the flu, right? Get that flu shot. Next question, and I love this one, and there's several of them because it comes from teachers. So we've been talking about our kids going into the classroom. Let's think about those teachers that are actually going to be exposed to those kids. So the question is, how should, as a teacher, what are the best actions that we can take to keep safe as these kids come back into my classroom? Any advice or guidance?
My sister is a kindergarten teacher, so I've been talking to her about this quite frequently. And you know, what we saw, we've learned a lot about this disease since March. And you know, the majority of our healthcare workers have remained safe by wearing the mask and following the procedure. And I think if our teachers do the same, they will remain safe, the great majority. Now, each of them also has to make that personal decision, work with their district, because if they have a chronic medical condition, if they're more at risk, then of course that's a different situation. But I feel like the teachers are in the same place that we were back in March where we just didn't know. And so we really want to help them to understand our experience and how it can help them.
So here's a follow-up. Does the virus live on paper? So as a teacher, I'm wondering if I can hand out worksheets and note packets and articles to my children. I mean, these are very practical questions, and I appreciate the person that wrote that in. So I'm handing out paper. Good idea, bad idea?
So I'll take that, but I don't think that the evidence is clear-cut. We know that the virus can survive on certain surfaces. Cardboard maybe about 24 hours is what the data has told us. We know that the printing of newspapers, that process alone might inactivate the virus. How it is for papers that we're Xeroxing, I haven't seen anything written about that.
Yeah.
So I think the more we can do with the virtual, with the kids with either their iPads or their Chromes or whatever they have, the better. I'm sure there will be some paper. There has been no known cases or transmission secondary to paper, and I think most importantly that the kids wash their hands, use their own writing utensils and crayons. That I think is more important than the paper, and I think we just watch for more data to be available in the days and weeks to come.
Sure, absolutely. Any additional comments there? All right, so here's one very practical question. Is it safe for me to put my child on a school bus with 50 other students? And because my kids are sort of grown and gone, I don't know how school districts are handling the busing. Does anybody know? Are they reducing the size of kids on the buses? We're going to take 20 instead of 40 or 25 instead of 50?
Yeah,
Does anybody know? Because I don't.
So I've been part of national conversations from the Peds ID Society and the National PTA with respect to that question, and there's no pat answer. Of course, we want social distancing, which is not always possible. So some of the recommendations that have been suggested have included assigned seats on the bus, so that if there is an exposure, it might be limited as opposed to consider the whole bus. So assigned seating, not using every seat, which is not always possible for the school district, or staggered buses and staggered start times. I think each district area has to be creative based on the resources and the needs of their students, and mostly, bottom line, to try to do everything they possibly can to keep kids safe.
Yeah. Any other additional thoughts or comments about that one?
I know that drop-off and pickup will also be different at most schools, requiring masks and just the protocol. And I would say just look at your district and follow the protocol.
So back to masks. A lot of these questions have to do with masks. Are there lasting effects from kids who have to wear masks for so many hours a day? So is there anything that we should be concerned about as parents if our child has a mask on most of the school day? Any lasting negative consequences that...
Boy, none that I'm aware of.
No.
I see that it's very, very safe. I've seen some questionable articles put out there that I don't believe are based on evidence. So I do believe that it's safe. And in fact, it's really the best step forward of masking and social distancing along with hand washing. So what I would say is it's safe to do, and it should be encouraged and certainly enforced when possible.
And I think that's, again, why we want to practice with the kids at home, so that we know that they have the mask that fits them, that they're comfortable with wearing, so they're not constantly touching their face, because that's the other thing we need to teach our kids, is not to touch our face if our hands have been contaminated, and to wash our hands. So comfort, I think, is critical.
But I would add that there's a few circumstances where you wouldn't want to have the child wear a mask. Anyone under 2, we recommend no masking, or somebody that has any type of neurological illness that is unable to remove the mask themselves. We're not recommending masking for those people.
And some children can't tolerate it, so kids with autism or certain developmental issues. So that's a case-by-case basis.
Thank you, Frank. Good point.
What about sports? My kid wants to play sports, wants to swim, wants to, field hockey, whatever the case is. What are you advising parents around sporting activities?
So we did our first soccer scrimmage this Saturday, and I was a little hesitant about it, but they did a great job. They followed protocol. Everyone wore a mask to the field. All the spectators had masks on. The kids had cones where they could sit when they were off the field. I think now, I would take advantage of it now when you can do outdoor sports, because the risk of transmission is less in the outdoors. I think we'll find out more over time, but again, getting back to what Bree said, if you're uncomfortable, if you don't understand, then challenge the coach. Make sure that they're following the protocol, because you have to feel comfortable, but it is also really important for kids to participate in those activities.
And soccer, I don't. So this question was specific about contact sports, and I want to do justice to it. So, there's one thing if your kid's in a lane swimming. There's another thing if your kid's, tackling somebody on the football field. Any particular point of view around contact sports that might be different from the other?
I think we have to be sure that, again, the rules are being followed, that nobody comes sick or with any symptoms at all. Maybe screening should be done before practices. There's different ways to approach it, but you can do screening. Also understanding that when they're done with what they're doing, they separate, okay, that they're not huddling, et cetera, like we usually do. And many of us haven't seen each other for some time, and the first thing we want to do is shake hands or give hugs, and we have to remind ourselves.
Right.
So of course kids are going to need even more reminders to not do that. But I think we also have to understand that different levels of contact bring about different levels of risk. And so every family is going to have to decide what level of risk it wants to deal with.
I'll add, just as a kind of a sidebar comment to this, that when it can be done safely and when families feel comfortable, it can be really good for mental health. So I feel like I need to throw that in. And also just to mention to families and parents that if a decision is made that your child can't participate in sports, that can be very upsetting to them, and just to listen and validate those feelings, and don't try to minimize them, because it is a big part of their social life and a big part of their development for those kids who do participate.
So this question has come up again. I know we've spoken to it, but the fact that it comes up again gives you a chance to maybe reinforce your earlier response. Will it be important to have students get flu shots before school starts? Will it be important for kids to get flu shots before school starts? What are you advising your patients?
Say as soon as you can. As soon as our supply comes in as clinic, we put that shout out to say, yes, get your child in for that flu vaccine. We feel very passionately about that.
No.
Yeah, most shipments usually start sometime in August, but we won't know for a little bit of time. So I agree with Kevin. You know, as soon as it comes in, your pediatrician will probably be notifying people, get in and get the shot.
Yep. So here's a question that's going to maybe put you on the spot a little bit. We've been talking about social distancing, right? And we're 6 feet apart or more, and we've talked about masking and washing our hands and social distancing. The comment is most schools cannot guarantee 6 feet of social distancing in the classroom. What are your thoughts about that?
So I will say that the American Academy of Pediatrics has come out with statements saying that if the school can't, to try to at least have 3 feet of social distancing between the desks, as long as everybody is facing forward. Not everybody agrees with that, I have to say. Okay, but that is one comment. Schools, and they also need to ensure that the masks are being worn all the time, definitely in those situations. And hand hygiene and wiping down of surfaces at selected times based on what the districts decide.
And then for lunchtime, if they can space the lunches where they can get 6 feet apart, because then they'll have to take their mask off. So just looking at those two different scenarios.
Okay,
it's important for people to remember that there's not going to be a situation where everything is perfect or that school can do every single thing. There are going to be some things that you have to give and take a little bit with. So I think it's important to continue to remind students that are returning to school that it's important to follow all of the steps. Like, wear your mask, but just because you have your mask on doesn't make you exempt from washing your hands that time, or, everything needs to happen, because in the event that you're not 6 feet apart, the other things will hopefully protect you from those things. So, not skipping out on all of the steps.
Right, have several layers.
Yes, exactly. That's why there are so many layers to it.
Yeah.
And I'm going to add one more thing. I think the other thing that's being stressed by all the literature is don't come to work sick, don't come to school sick. Stay home if you have symptoms, if you're not sure. Call in, etc. We need to be mindful so that we're not spreading whatever we might have.
So most of our conversation has been about young kids. We've been talking about crayons and young kids. But here's a question about colleges. My kid's getting ready to go back to college. What do you suggest for colleges trying to balance student life and campus safety? What suggestions might you have for institutions like colleges about balancing student life and campus safety? Any initial thoughts, any reaction to that question?
Well, I've done a lot of reading about this, and one of the comments that stands out is if we don't make some of these things available for the students, they're going to be out and might be practicing unsafe behaviors anyway. So I think that the institutions need to make activities available for the students that are allowing the social distancing and encouraging the masking, but yet allowing people to get together in a safe fashion. We need to be even more creative than we've been in the past for the students to be able to be together.
I think being creative is very important because we have to find a way to normalize this.
Right.
We don't know when this will end. People always ask me when will we stop wearing masks, or when will we stop having to do this? And I really have no good answer to that. So I think we have to get to the point where this is our level of normalcy and it's acceptable, and we have to get creative to reach that population of teenagers or college students who may not be as happy about that.
Right. I mean, it's an overused term, but it is kind of a new normal, right? I mean, COVID's going to be with us for quite some time. I hope we get a vaccine soon, but it's certainly not going to be in the next few months. So we've got to learn to kind of carry on,
embrace
right?
This, yeah.
Yeah, exactly. Another question for you all. Should a child be tested for COVID before school starts, even if they're asymptomatic?
Well, I would say that official CDC recommendation, which I'm aligned with fully, I think we all are here, is that it's not recommended. And the reason it's not recommended is because when we're testing people, we're testing them usually based on symptoms or exposure where there's a reason to believe they could be positive. It's a target in the dark if you don't have any symptoms and we're just randomly testing. Now, with that being said, of course, there are NBA and other places that are testing every day. Well, that's a different story. But the reality is we don't have the ability, the capability, the access to test every single person every single day for surveillance. So a one-time test before school is not going to be helpful. It would not be recommended.
Okay, you guys are all in agreement on that. That's since testing came up, and none of us want to be alarmists, right? But we do need to perhaps express to our viewing audience that we're all a little anxious about testing capability now. There's a national and an international shortage of testing reagents. We know that the White House is now directing testing kits to go to the hot spots, and so you may find areas like Illinois and Wisconsin not having as many testing capability. Does that cause you additional anxiety as practicing physicians when maybe our testing ability might be compromised a bit? And I'm saying maybe, because we're hoping this is very short-lived, and we have a decent inventory at Advocate Aurora Health right now, but I know we're kind of watching that pretty closely. Comments about testing capability?
Well, testing is always useful because it tells you what you're dealing with and what you need to do for the contacts and quarantine and isolation, et cetera. That being said, the CDC does have guidance so that if testing is not available, how to deal with symptoms, and I'm talking in the outpatient setting now, how to deal with symptoms and how long you need to quarantine and isolate if we don't have the testing. I think going forward, as we're going into the respiratory viral season, that's going to be our concern because it may be difficult in the pediatric population to distinguish COVID illness from the other respiratory illnesses that we usually see. And we also need to be mindful that sometimes kids can have more than 2 or 3 viruses at one time. Yeah. So time will tell.
Right.
I would say we just have to be fluid with it too. I mean, resource allocation has been a concern since the beginning of the pandemic, whether it be for PPE or for testing supplies. So being good stewards of the testing, making sure we're only testing when it's going to result in a clinical decision that we have to make, and then, being able to pivot back and forth if we see decreases in certain parts of the country. So we're all in this together and we'll make it work.
Yeah, yeah. I can't believe that our time is literally, I'm getting the sort of the hook a little bit because we're getting very close to our time being expired, and it's gone so rapidly. I want to say to our viewing audience that there are so many more questions here that we did not get to. Questions about my child's an asthmatic. Tell me about masking for asthmatic. Special needs kids. There are questions about that. How do I bring a newborn home after I've had a baby? All kinds of questions. We will promise that we are going to publish those on our website, so we answer those questions. We're not able to do it here within the time that we have, but I want to give all of you as panelists sort of a last opportunity to convey a final message to our viewing audience today. So if you had 10 or 15 seconds, what would you say as a closing remark? And I'll start with you, Dr. Belmonte.
Follow the science, wear your mask, and get your flu shot.
Perfect. Dr. Jacobs?
I would agree with that, but as the ICU doctor, I also have to say that, it's always my hope that you guys and your kids stay healthy and stay safe, but in the event that you are experiencing any life-threatening symptoms, please come. We are here. It is safe for you to come into the ER. It is safe for you to come in and see us, and we're happy to help you.
Great message. Marianne?
Take it one day at a time. Wash your hands, wash your hands, wash your hands is what I always say. Wear your mask, social distance, don't touch your face, and be nice to yourself.
Be nice to yourself. There you go. Kevin?
I would say, as a pediatrician, we welcome the phone calls. Come in and visit us. Bring your child in for their physical, their immunizations, their flu shot in particular. And if you have questions about your child's safety and returning to school, call us. We're really a part of that decision. We're committed to helping your child live well.
Gabrielle?
As it pertains to all of these decisions about school, decisions about sports, I would leave you with the right decision is the decision you make to the best of your ability. We all can, the best any of us can ever do is to make a decision based on the information that we have available to us at any given time. If we could see the future, we wouldn't be having this conversation. So make the best decision you can, the one that feels most right or that feels the least bad, as it were, and be kind to yourself. This is hard, and it's hard on all of us.
Yeah, that's great advice. Absolutely great advice. Folks, we are out of time, and unfortunately, we didn't get to all those questions. We promise we will have this conversation going forward in the days and weeks ahead. We encourage you to check out our website at Advocate Aurora Health. It's aah.org, and our social media channels for all the latest news. As I said at the outset, your feedback is really important to us. So take 2 minutes to fill out the survey here at the end, and we really want to thank you for tuning in. We thank you for your trust and confidence in Advocate Aurora Health. It means a great deal to us, and we are doing everything in our power to take great care of you and your families. Thanks for joining us today. God bless you. Bye-bye.